welcome to the HCA Module 1 lecture. Hopefully you've had a chance to take a look at the opening video that kind of describes the course, as well as a little bit about myself. Today we're going to talk a little bit about basic computer hardware networks and HIT. Now, as I mentioned before in the previous video, why we utilize IT in healthcare. And you have to remember that healthcare is a vertical like other verticals, and it has the same or similar business operations that other companies or corporations have, other verticals have. So a hospital, like any other company, will have similar needs with respect to IT, including supporting their business operations. In this specific situation, managing admission and discharge of patients, as well as any charges to their accounts, and of course billing. It also supports, healthcare IT also supports healthcare operations like schedule and reporting for accreditation purposes, provides the ability to allow for clinical documentation by clinicians to report on the patient's condition as it improves or deteriorates. And of course, we hope that it does improve. It also allows for the facilitation of information and patient data between caregivers, as well as between the caregivers and the billing, whoever's paying the bill, whether it be insurance or the federal government, Medicare, Medicaid. It's also utilized for improving patient care and safety through either decision support as well as quality indicators. And of course, it provides a certain amount of security with that protected health information. I hope you had an opportunity to read the first three chapters, chapter 1, 2, and 4, as well as the information on the assigned video covering computers, networks, and infrastructure. Because this week we have 4 objectives, the first of which is to identify the basic components or elements of a computer system and the infrastructure, and that's going to be covered quite a bit. Now remember, this is not a computer class. However, a basic understanding is required and is provided to you with the reading materials and the video to help understand the healthcare IT subject matter. The next, and that'll be a self-study to a degree where you're actually going to be reading and doing some of that stuff on your own. Hopefully most of you have a basic understanding of information technology, at least with computers and with networks, and the basic understanding of how things work. Otherwise, I find it very hard for you to actually attend this lecture if you didn't have any idea of how computers work. So it's very ubiquitous in our life, and we utilize them quite heavily. So a lot of this will be pretty basic understanding for many of you. As far as describing the categories of healthcare, as I mentioned before, the business information systems that keep the hospital running, the registration systems or the ADT systems that we may talk about later, scheduling systems, including the master patient index, which has been mentioned before, that allows for some sort of a place or a location for patient information to reside and for it to be tied to, would be that MPI. We also have pharmacy information systems, and again, we talk about the decision support systems with allergies or contraindications, certainly weight-based formulations, the lab information systems, which interact with other systems to allow for transfer of information such as lab results. Imaging is also very big, especially with the picture archival systems. When you go in for an X-ray or an MRI or a CT scan, a lot of those images are then archived so that the picture can be pulled up later by the healthcare professional that's looking at to either treat or to diagnose that specific issue or illness that the patient is presenting with. Electronic health record systems. We'll talk a little bit about EHRs, EMRs, and patient health records, PHRs. And electronic medical records, just to get this out here, is really the electronic medical record for that particular facility. When we're talking about an electronic health record, that is transcends the facility and goes beyond to other facilities, to ambulatory centers, to perhaps to insurance companies. Certainly that whole health information exchange would be in that electronic health record. Now with the patient health record, that's more specific to the patient and stuff that the patient can control and maybe even contribute to from their home. whether it be blood glucose results or BiPAP or CPAP settings. So those are some things that the patient can actually contribute to and has a little bit more control over, rather than a facility which kind of owns that electronic medical record, even though it's the patient's personal information. The clinical decision support systems, we've talked about that already. The data points that are brought together to create information. There can be rules that are put together in these systems so that clinicians are alerted when a certain threshold is reached, or a tolerance is reached, or a lab value, or a maximum dosage has been reached. So those clinical decision support systems usually are integrated with the electronic medical records or electronic health records to allow the clinician more information by which to make decisions.